You with Lachlan Kitchen and Neil Odger this afternoon. Today, Monday, the 14th of November, is World Diabetes Day. And according to the World Health Organization, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces.
That's right. The challenges also come through in multiple ways. It's called the issue starts with diabetes, then it goes on to affect your kidneys, your heart. All of these things they start working in that function that if one gets impaired, the other things come through, and majorly it's the lifestyle that messes it up for all of us here.
Well, to get more details about this is the consultant endocrinologist at Fakeeh University Hospital, Dubai Silicon Oasis. Joining us is Dr. Archana Purshothaman. Thank you very much for joining us on TSB.
Yes, hello everyone. This is Dr. Archana, and I'm very glad to be live on this wonderful occasion of World Diabetes Day week.
Yes, it is a remarkable one. But, when we look at the population, what percentage generally are affected by diabetes?
When we talk about UAE, it's about, whopping 25%. And, these are just numbers that come to the doctors. So, because diabetes is a silent disease, there's a whole lot of people there waiting to be diagnosed.
Wow. So isn't it a lot to do with the amount, the lifestyle that we all follow?
Absolutely. Actually, that's where, the key to having this World Diabetes Week is creating awareness. Is because, a lifestyle is one thing that we take, so easily taken for granted. Mm-hmm. And it's so important to know that just making changes in your lifestyle, you can, have the control of your health in your hands. So lifestyle is actually a very, very big part of preventing and treating diabetes.
Doctor, we hear so much about diabetes type 1 and diabetes type 2. What are the main differences?
Thank you for that question. So, because, for most people, they associate the different types of diagnosis based on what age they're first diagnosed. So usually type 1 diabetics is when your body does not make any insulin at all. So, it's usually diagnosed anytime as early as after 1 year of age, and typically in the early teens. Having said that, there are type 1 diabetics which are diagnosed later in life too, but 90 to 95% of diabetes is type 2 diabetes, which is because, of our lifestyle, obesity and stress and all of the factors. So even though your body is making insulin, like you said earlier, you're not able to effectively utilize it. So that is something which can be easily reversed. The key here is reversal. Because type 1 diabetes, you don't make insulin, you need to take it. But if you're a type 2 diabetic, you can very well reverse it and, control it.
A lot of conversation has come up in today's time where you use this term reversing diabetes. Back in the days, it used to be that once you got diabetes, now you're associated with pills that you have to take, throughout your life. How has the reversal of diabetes come through, and what steps should one take to effect that?
Absolutely. Thank you for that question, because we get a lot of, young people very concerned about this diagnosis because they take it as a taboo, because they associate diabetes as a lifelong condition, treat pills and doctor visits. And they always ask us, is there any way I can, not take medications? Absolutely. So reversal is, basically when you start, eating right, exercising right, so that your whatever insulin is produced, your muscles and your soft tissues, your fat tissues in the body can effectively utilize it to bring your glucose down. So it's all so if you eat a carbohydrate-rich diet, the amount of glucose that your body has to deal with is much more than what your insulin is being produced.
True.
So it's basically, having the right balance between the carbohydrates as well as having the right amount of exercise and lifestyle to be able to utilize it effectively.
When it comes to factors for diabetes, are there certain trends? Are there age groups, or is it male, female, or certain parts of the world that give you a higher or lower chance of developing diabetes?
Absolutely. So actually, the subcontinent and, the Asian continent is, we have diabetes at a younger age and at a lower BMI compared to the Western world,
Mm-hmm.
which is why it's very important, anybody above the age of 35 should be testing themselves even if they don't have any symptoms, or earlier than 35 if you have a family member, or if you're overweight, or, you don't have a good lifestyle, if you're smoking, or you for any reasons, you've checked your cholesterol, or you've been told your blood pressures are high. All these are, red flags where you need to get yourself tested for diabetes. So yes, younger population in our countries, even with a lower BMIs, we have to be on guard.
Well, that doesn't surprise me, Doctor. I've seen the sweets that go around the office when it comes to Diwali, so it's no surprise sometimes.
Kids,
Absolutely.
the
Yes.
idea is to eat sweets and burn them out. Don't stop eating them, but yeah, go out and burn them.
No, exactly. And unfortunately, the human race associates happiness with, sweets. So I think in any part of the world, whether it's Christmas, whether it's Diwali, you associate celebration with having something rich in sugar. So I think that has to slowly change. And it is changing for the better. You can substitute sugars with fruits, with, chia puddings. There are alternatives. So
I love chia puddings.
Yeah, you do. So you can definitely share a recipe with the audience.
I definitely will. Now, I wanted to ask you, and this is something that, everyone thinks of diabetes in isolation, but there is a trifecta of, as they say, the big triangle. You get diabetes, your heart and liver, your heart and your kidneys also get, absorbed in this problematic zone. Could you highlight something that how does that happen and why does that happen?
Absolutely. So diabetes is actually a condition because of the high sugars. There's inflammation everywhere. Because of the high sugars, there's inflammation everywhere in the body. And that affects your heart, your kidneys, your eyes, your nerves. So you're actually, like you very rightly said, you're not only treating your sugars, you're treating and you're preventing a whole lot of complications, which can happen at any stage of your diabetes, no matter how old you are, and no matter how healthy you think you are. So, which is why, it's a multi-pronged condition.
Now, when it comes to treatment, what is available for anyone who might be concerned at the Fakeeh University Hospital at Dubai Silicon Oasis in regards to diabetes?
Absolutely. We have a great team here at Fakeeh Hospital, which is 2 endocrinologists. We have our diabetic nurses, which are trained very specifically in checking sugars as well as giving injections. And when we have diabetic educator, who does a lot of our dietary counseling besides the dietitian. So, if you've been listening to us and you're aware of the World Diabetes Week and in general diabetes, please come over and, we are here to help you out and we always have a very individual approach. There's so many advances in treatment right now where you can clear your doubts and we're here to help you.
Well, it's great to get your thoughts for today being World Diabetes Day. Joining us on the phone has been Dr. Archana Purshothaman, the consultant endocrinologist at Fakeeh University Hospital in Dubai Silicon Oasis. Thank you very much for your time this afternoon on World Diabetes